Hello everyone, I'm Raisa and this is Dr. Bushra. So we are here with PHWC, and as you may know, October is World Mental Health Month. And so to celebrate this month, we at PHWC are doing a series of videos throughout the month of October focusing on various mental health issues. So I have with me today Dr. Bushra Sultana, who has completed her FCPS and MCPS degree in psychiatry. And we're going to talk about a rather intriguing topic today, which is addiction. Dr. Bushra, to start off with, what is addiction?
Okay, addiction is a condition where a person cannot control the intake of a substance or engage in any type of behavior repeatedly despite knowing that it is causing him some harm, and despite going into many type of dangers. And it can be any type of substance, and there are some behaviors also which are considered as addiction.
Okay, so what are then the different types of addiction?
If I talk about the substances, there are many substances. The most common ones in perspective of Bangladesh is cannabis, there's yaba, there's alcohol, there is heroin,
Nicotine.
Yeah, nicotine. Also some inhalant substances also, and some prescription drugs are also used here.
Yeah.
And in behavior, currently only one behavior is under the category of addiction according to DSM-5, that is gambling behavior.
Oh, that's interesting.
Yes, and also another one which is under consideration is internet addiction, but very soon we will also see in the text also.
I'm sure it should already be on it.
Yeah, it's high time.
Yeah.
And another funny thing, maybe, addiction to Hindi serials, maybe.
Yeah.
That would be helpful.
Is caffeine considered an addiction?
Yes, it has.
Yeah. So in that case, like a lot of us would be considered addicts then, I suppose.
A lot of us.
Okay. The different substances, or what like the different types of addiction does to your body.
Oh, okay. Well, as I was saying, the different substances are cannabis, alcohol, opioids, caffeine, tobacco, like cigarettes, and the behavior is gambling behavior. And what happens is that the common theme here is that any addictive substance or addictive behavior, they do some neurobiological changes in the brain. They activate the reward pathway that releases a neurotransmitter which is known as dopamine. So what happens is that when the dopamine is released, we get a feeling of a high, like we feel very happy. There's a feeling of pleasure, and the person cannot get out of it. Like what happens is that even like natural stimulants can also cause this high. Like if we eat a yummy burger or pizza, or like if we watch a movie which we like, or if we do any pleasurable activities, that also activates the reward pathway, and that releases dopamine also. But in those cases, the dopamine release is controlled and it doesn't become uncontrolled. That is, the person can stop those behaviors after a certain point. But in case of addictive substances or behaviors, the reward pathway is activated to such an extent that the dopamine is at an extremely high level, and the person keeps on repeating those behaviors even if he's facing many harmful consequences for it. Okay. And that leads to addiction.
Okay. So how do you recognize an addict? Like what are the telltale signs of an addict?
Okay, there are two perspectives here. One is the perspective of the friends or the family members. Another one is the perspective of the physician. Well, I'll start with how the family member may suspect. Well, if a person is an addict, what we can see that there's a sudden change in his attitude, his personality. He will have some mood swings, changes in his sleep pattern. Like most of them have insomnia, and there will be loss of appetite or increase in appetite. So there will be drastic weight gain or weight loss, and the person becomes very irritable, gets angry in small matters, and he will be trying to ask for money. He will fall into many financial problems. These are not absolute signs of addiction, but it may cause some worry. And if something like this happens, then the parent or the friend may suspect that the person is becoming an addict.
Okay. Well, these signs all sound like, I mean, it's not absolute, like you said, that these signs have to be a sign of addiction. I mean, don't you think a person who is depressed can also show these signs, like loss of appetite or, changes in sleep pattern? So how do you then differentiate? Or sometimes that even happens to, like, people like teenagers, like mood changes, sleeping too little or sleeping too much. So then how do you, as a family member or as a loved one, how do I know that this is what's going on?
The important thing is communication. Like if the family member is supportive and has a good relationship with the person, then he can just approach him and then ask if something is wrong. Another thing is if a person is an addict, there are also some environmental clues, I may say, that indicate that the person is using some addictive substances, such as remnants of the instruments,
right,
or the substances which may be found in the room locked away or maybe out in the open, like burnt foils, burnt spoons, a lot of lighters. And the changes which happen in addiction are very sudden and very drastic, and usually there's no other explanation for the psychological or the physical changes. And in case of depression, usually there is some other factors which cause depression,
okay,
and that doesn't usually happen in addiction.
Okay, so are there certain risk factors with addiction? Like, is it inherited? Is it genetic?
Yes.
What do you think?
Yeah, there are some genetic factors here. Like it has been revealed in many studies, twin studies and adoption studies, that if a family member is addicted, then there's a high chance for the person to become addicted himself.
Okay.
But that is not the only cause for addiction. The environmental factors also interact with the genetic factors.
Right.
So the environmental factors are far more important here, such as if the person lives in an area where there's a lot of availability of the substances, and then if he comes from a low socioeconomic background, if there's stress in the family, if there's a dysfunctional family relationship, and if there's any history of abuse, such as physical or sexual abuse, and if there's any emotional or mental disorders, these all predispose to addiction.
Okay, all right. So how do you go about, from a physician's point of view, how do you go about treating this? Like, it's still a taboo topic, but how do you provide therapy for people who are addicts?
Well, if a person is an addict, the first thing we should consider is how much motivated is that person to control his addiction. If the person is not motivated, then there is nothing left to do. So you have to know that if you are an addict, you need to change, and you need to change yourself. No one else can do it for you. Mm-hmm. So after a person, say if an addict person has suddenly decided, I want to manage my addiction, then he may go to a psychiatrist or an addiction counselor, and then he may be offered many kinds of treatment. There are many treatment strategies out there, but the most common ones are counseling, support, group therapy, family therapy, and in some centers there are 12-step programs, and art therapy, music therapy, many sports activities. These are all part of the addiction treatment program.
Right. So then you're saying that, there are many ways to get better, but that's only possible if the person wants to get better themselves. Like, no one can force them to do it. I think, it's fairly common here to see where family members are dragging you to rehab centers without your consent.
Yes.
And you're saying that if that happens, then the treatment
won't be effective.
No. Right.
Then the person will, after he comes out of the center, he will relapse. So.
Right. So that leads me to relapse then. I'm sure a lot of people, I'm sure you have seen in your patients as well, that people do relapse.
Yes.
So is it possible to actually recover fully even after one or multiple relapses? Or sometimes, like, people give up hope, or the family members or the loved ones close to them, like, they give up hope. If they've relapsed once, they think, acha, eta okay diye hobe na, like, they'll always be an addict. But Is that the case?
Not the case, and relapse is quite common in case of addiction. And if you have relapsed once or twice, that doesn't mean that there's no hope. In fact, it can make you rethink about how you got addicted, why you relapsed. You can reassess your path, and then you can try to go back into the therapy, or you can manage yourself by going into some support groups and then rebuild those skills necessary to stay out of drugs.
Yeah. Okay. All right. Well, thank you so much. Are there any concluding remarks that you want to say before we wrap up?
Yeah, I want to say that one thing I should have said, that young people, the youth, and especially adolescent or teenagers, they are very prone to addiction because they are at a developing age and the brain is developing. That is their risk-taking, their decision-making capabilities, their self-control, all are at a developing.
Right. So they're more vulnerable.
Vulnerable to take risks and to try different kind of substances. They become curious when they see their friends or someone they know taking substances, and that is a very vulnerable period. So it's important for parents and family and also friends to know that this is a very sensitive period. And so if someone you know who is going through this, you shouldn't lose hope. If it's your loved one, then what you can do is help them by motivating them, by encouraging them to seek treatment. Of course, it has to be from their own will. It cannot be forced. And if you're an addict yourself, then you should know that there is a way out.
Right. So I guess, because addiction is still a taboo in our society, it's important for people to know that you shouldn't shun someone or corner them or isolate them just because they're an addict. Rather, what you're saying is you should show support and show empathy towards that
That's
person.
where family therapy comes into play. Like in family therapy, it's the family relationships, the interaction, the dynamics of the family, they are worked on so that there is a positive dynamic, and that's how the treatment becomes more effective.
Yeah, and I guess that's even more important in teenagers because they're also more likely to go to do certain things under peer pressure, more so than adults who are in their say 30s or 40s. Teenagers are probably likely to try different things. Well, thank you so much, Dr. Bushra. I hope this information was as informative and interesting for all of you watching as it was for me. And I want you all to know that we at PHWC are here for you. Our doors are open. We're here on Banani Road 11. If you think that any of this is relatable for you and you want to come talk to somebody, feel free to come and get in touch with us. Thank you so much.